The arms are almost like the nose of the body. It is what everyone focuses on. When the weather gets warmer and you're wearing your tank tops and your short sleeve shirts, for some patients, whether they just genetically have fuller arms, more fat or more skin, or someone who, say, has lost a lot of weight and just has a lot of hanging skin on the arm, it is a huge source of embarrassment if they can't find tops that fit, or they feel like they've got a waddle or a bat wing or whatever they like to tell me. And it's one of those things that really affects how somebody wears their clothing, how they carry themselves. It's actually one of the most common procedures people come in and ask us about. First and foremost, we're going to look at the skin and the quality of that arm. If that skin is loose, if there's excess skin, it's just like on an abdomen. We need to talk about a brachioplasty, where we excise the skin on the arm, and you do have a scar that goes from your armpit to your elbow. But when we mark, when I have you in your pre-op room, I will do extensive markings and measurements to make sure that we get that scar in a position that's as imperceptible as possible when you're standing, so that from the front and from the back, that scar is pointing towards your body. And the scars nowadays, they fade so nicely. The next question becomes, well, what if a patient has pretty good skin tone, but just a little extra fat? We talk to patients who have extra fullness in the arms about liposuction, but liposuction is not today just what liposuction was years ago. Now we have options with energy devices, and what do those add and what do those bring on? Well, those help to heat the tissues below and cause skin tightening and cause that skin to retract. It's kind of like the icing on the cake. You know, if I just did the laser alone, that wouldn't be enough for most patients. If I just did liposuction, they would come out with a good result. But I want my patients to have great results.